Okay, good morning, everybody. Thank you so much for joining us. I see there's still a few people that are going to be coming in a moment. It's lovely to actually have everyone on a meeting as opposed to a webinar, so we get to see you. So feel free to share your videos. So for those of you that I haven't met, my name is Tracy Freeman. I'm with BPESA and I look after the marketing and growth and have been supporting a lot of our activities that we have been busy with regards to COVID and the impact that COVID has had on us as a country and as a sector for this year. I think we're all sitting in a very strange place at the moment where we all had this assumption that come the end of 2020, we could just forget the year, move on and start 2021 afresh, and that is clearly not the reality. It's going to be interesting to see what our president has to say this evening with regards to his update. And I'm sure that post this call, there'll be one or two things that we may need to communicate with you this evening and tomorrow to say, okay, guys, here's a couple of new things to consider and make sure that you're thinking about. But we are thrilled that both Fumane Kumalo from HESAP Consulting and Shaun Whitehead from Harambee have agreed to join us and really share with all of us some best practices that they're seeing coming from their side. And apologies for me jumping around. I'm busy multitasking, admitting people as they're coming in and trying to chat to you. But there's constantly so many things that we have to be aware of. And we're very well aware of the fact that there's a lot of complacency that's sneaking into our country, to our citizenship, to our sector, and to us as well. And I know that we're all guilty of this, that we want to sort of forget that it's actually a reality that we have to consistently be conscious about the fact that the virus is very much alive, kicking, and around us. We are really grateful to each and every one of you as participants in our sector, in the global business services sector, that you have really adhered to the protocols that you helped to establish right up front, that you've taken a people first approach, making sure that our staff are safe, whether they're on site or at home. And we will touch a little bit on that today. Just reminding everyone that when we're at home, it seems to be where we're more complacent than at the office. So we really are just want to say thank you to you. If we have a look at the weekly reports that you've all been so kind to continually update and submit through to us, the statistics that we're seeing coming through from the sector, from the global business services sector, in comparison to the national statistics, we're actually sitting below the trend. We're not copying the trend, which is fantastic because it shows that we're doing something right as an industry. And so much so that with us reporting on a weekly basis, the global business services sector and yourselves as organizations are really being highlighted at a national government level where they're using our sector as an example of best practice. And they're really encouraging any other sectors to take a page out of our book, to start reporting and to really start ensuring that they're adhering to the protocols that are out there. It's a strange new world and we seem to be managing it really, really well from a sector perspective. So what I would like to do now is actually pass over to Shaun Whitehead, who's going to kick off the webinar with us. I'm going to ask everyone to please go onto mute so that we can all hear what it is that Shaun has to say, and he will be passing over to Fumane. And then after that, we have Christopher Lawson from CCI, who also wants to share with us some of their best practices that they've seen, some really sort of practical on the ground tips and challenges. And we're all quite aware that there were a number of organizations that were hard hit as we were trying to sort of figure our way around in the early days of lockdown. And CCI sadly was not, was one of those organizations. So Christopher has a lot that he can share with us. But the reason we're running this as a meeting as opposed to a webinar is we really want you all to please get involved, share your views, your thoughts, your opinions, your suppliers. We can only do this as a collective. So it's important for all of us to really say, well, guys, you know what, this is what we found worked, or these are some of the challenges we're having with our staff. And hopefully we can either support and respond, and if not, we'll seek external guidance and come back to you with a response if required. But it really is supposed to be engaging and interactive. So at this point, Shaun, if you're ready, can I pass over to yourself to kick us off, please?
Absolutely, and thank you so much, Tracy. Thank you for everybody joining. It's a wonderful opportunity to be able to reflect and share. I'm going to speak from my own personal experience and learnings without incriminating anyone or any organization or governing body. It's been an absolute crazy journey, to say the very least, and it's something that I've learned is that it's really lonely at the top. And when I say the top, it's where decision making needs to happen, where implementation and the assessments and the maintenance need to happen, and confronting the brutal facts. Tracy alluded to it now that it's in our homes, it's in our communities, right next to us. So when we started off in 2019, this distant virus that was limited to a far off country that's crept into our organizations, in our homes, in our communities. And where I found strength and clarity was through collaboration and being able to learn, adjust rapidly. That's also why Fumane Kumalo joins us today, where as part of our collaboration in Harambee, we outsourced some of this intelligence and be able to understand and just cut through some of the noise and make it more practicable. And we really hope that sharing some of the FAQs that we've gathered today and some best practices will also help you in that, and help you with some answers and more questions that you can take back to your safety committees and back to your executives, in order to make sure that we maintain and adhere to our duty to ultimately take care and prevent the loss of life and the loss of livelihood. Just on the suggested flow, Fumane and I will be engaging in conversation, and we'll be making reference to internal, external aspects, elements, and impacts. We'll be jumping around slides. The whole slide deck will be shared. I think it's important just to note that this is not a formal training session. It's really us sharing what we've learned and how we have applied this in order to make the circle bigger and for a collaborative effort. We also look forward to learning from you, and we hope that in the chat box, the questions coming through that we cannot answer today, we can circle back to. There's a lot of anticipation, not just with what is being expected from our president in changes in the regulation, but also the elephant in the room, us going on a festive break, already anticipating that there's some complacency. And how do we gear ourselves up to be ready for that 4th of January, for those that do close, with our teams joining us again, and make sure that all our systems and protocols are not just compliant, but also conforms to what our promises are and our policies are to our most valuable assets, our human assets. Fumane, I'm just going to hand over to you just for a brief introduction and just a scope before I start going through the frequently asked questions that we've identified. Over to you.
Good morning, everyone, and thank you very much, Shaun. My name is Fumane Kumalo, as Shaun has mentioned, and I come from HESAP Consulting. And the reason of this has definitely been quite a great exposure of having to work with Shaun and the rest of the other stakeholders, particularly in ensuring that we make sure that we mitigate the spread of coronavirus in their workplaces. And as he has mentioned, definitely earlier on, the best practices that we'll be sharing today is in terms of how them as an internal organization have tried by all means to ensure that they implement this, but also bringing in the external support from us as HESAP Consulting in ensuring that they are consistently complying with the regulations. And not only that, how do they monitor their best practice within the workplace? Because as you can see, the changes of COVID-19 have definitely brought in different elements of regulations, which each and every workplace was supposed to adhere to. And this was nothing but something that was definitely new to each and every person in the industry. And in terms of the support that we provided, it was in terms of advisory, as well as the compliance in health and safety, and ensuring how they continue to have business continuity, because during this hard time, it's difficult to maintain that while trying to ensure that your workplace still remains safe. And I think maybe, Shaun, we can definitely go ahead in terms of us having to discuss and share the practices that we've had. And we're looking forward to the questions and to learning from everybody and sharing just the experience in terms of what we have applied, in terms of what was working and what was implementable and the control measures, and up to the stage where we are at right now. And also the recommendations that we'll be bringing forth to everybody to try and apply in their workplaces. Thank you.
Awesome stuff. Thank you very much for setting the scene, Fumane. Just in advance, I want to say I am joining the webinar from our office in Gauteng with my mask on. It's one of our non-negotiables in preventing the occupational spread of this virus. So forgive it if it looks a little bit cloak and dagger. Not the case at all. Fumane, I'm going to kick off, go right into our frequently asked questions. And we look forward to getting more on the chat box. If we do not manage to answer all of that, then we'll circle back. And we'll also create an opportunity at the end of our presentation or discussion for some more questions from our audience. Fumane, you've mentioned now that we've got the COVID-19, this pandemic that hit us, and the country went through lockdown, and there's all these regulations and acts and all these amendments. And making sense of all of this is almost impossible. It's open to so much of interpretation. Some might even say that there's some ambiguity in it. Ultimately, if you had to, and this is a very unfair question, but if you had to ring fence or outline what the responsibilities of both employer and employee is during this time, what would be those key points?
I think, Shaun, what I'll start first by saying is that even prior to the pandemic that we are currently experiencing right now, there has always been a joint responsibility of an employer in a workplace as well as an employee. And the reason I refer to joint is because an employer, I'll just highlight basically on two things, which will cover some of the stuff that are here basically on our slide. An employer, by law, they are required to provide a workplace that is safe and without risk. And this is something that we have seen coming through, particularly during now, COVID-19. However, it has been existing even prior to COVID-19, which is one of the requirements of the Occupational Health and Safety Act. But if you look into that, once the employer has implemented that, an employee has to ensure that they abide by this law and they ensure that they comply by the lawful instruction of the measures that are implemented by that employer. And more so, an employer has the right not to permit an employee to work in a workplace if they are not implementing these measures, just so much as an employee has the right to basically bring forth and report any unsafe measures, that they are exposed to during this time. So it's a joint and a collective responsibility. And as you can see in terms of this slide, we definitely tried to call it the workplace responsibility for best practice. Reason being, this is a collective and a joint responsibility in a workplace. An employer cannot just implement the measures, whereas there's nobody who's going to adhere to these measures. So it's definitely important that employees in a workplace understand their joint responsibility and duty in ensuring that there's this workplace that is safe and conducive for them in order to work in and for business continuity. And yes, and Shaun, from I know you and I have definitely worked in terms of some of the stuff whereby we ensured the responsibility. And one of the things which I picked up, maybe which you can just touch on, is in terms of the commitment, which at the managerial level, how that assisted in a workplace.
Fumane, thank you. I mean, it seemed like there was a little bit of an alluding to the basic conditions of employment about, can and can't. It also speaks to the duty to inform. I just want to grab the opportunity and just share what we've done from a duty to inform point of view before we continue with the FAQs. We've made, on our side, we have elected to make the on-site safety induction a critical part of our onboarding and return to work. I call it return to work because we had to close our office at the end of July at a time when there was evidence of on-site transmission, only evidence. And this is where a PUI went into a case had a contact, and one of the contacts became a PUI. So for us bringing our staff back on board from a duty to inform, we made sure that all of our staff could come in a controlled way, into a controlled environment, that is safe and conducive for them, where we can then effectively transfer this information and also make sure that we've got their commitment. I think from other part to that, just the culture part and the integration part, key and critical on our side and what we have learned. And I mean, the theory is easy to assess in what is the chronologic flow, what is supposed to happen. What I have learned is just from a culture point of view is that we have to go from a point where the unknowns becomes knowns and becomes a second nature. And with that also comes the risk of us unlearning some of these things. So becoming complacent. So we then run separate to the inductions. We also run refreshers and keep the toolbox talks alive through our team leaders and through our managers to make them part of the solution. What we have learned is that there's a couple of boxes, in my opinion, that needs to be ticked in order to, ticked in the for lack of a better word, to make sure that the culture is alive and that it is driven and not just window dressing. And mainly that is, well, the organization itself, what does it stand for? What is the value proposition? And including safety as part of that and protecting assets, most importantly than our human assets. Leadership and just executive buy-in, just leading from the front. Our executives leading by example when on site and when having conversations, when having interactions, keeping that top of mind. Providing the necessary resources, and I mean we are going to touch on what is reasonably practicable, but making sure that the implementers are well equipped and well informed, whether it be through training or whether it be through getting the right kind of experience internally, externally, making sure that they've got the ability to be able to perform this function that is required or that is outlined by a health and safety policy. From an appointment point of view, so I just want to run through quickly organization leadership. From an appointment point of view, that's where the competence comes in. And briefly summarizing competence, in my opinion, would be an acronym that I use, SCATE, which is skills, knowledge, ability, training, experience, making sure that the right people are on the right positions and are also appointed based on what the legal requirements are. And Fumane, you can just help me here with the appointments. Some of these that jump to mind immediately include the compliance officer. It'll be the screening officer, it'll be the screening coordinator, the employee representative, and that's second to everything that is existing already, the 16.2 and the emergency responders and the incident and accident investigators, etc. So it doesn't take away from that baseline requirement or baseline assessment and implementation. Personnel, this is very, very hard. We've learned that no matter how proper a system is and how well it is designed and whether it's bulletproof, the moment you add a human inside that process, it becomes more complex. So being able to use your health and safety committee and use your executive as a sounding board to be able to make quick decisions and quick turnaround and doing a risk assessment on each of those. Sorry for digressing quickly. I just wanted to drop that in there. Fumane, back to the question and the answer that you provided with the responsibilities of employees and employer. Thank you for outlining that and also for illustrating that in that slide. Further to that, I want to ask you, in this complex world and all of us still doing what we were doing and taking on so much more responsibility and accountability in a time that is uncertain and there's so much that can be deemed fluid with regulations changing weekly and monthly, and some of these not even talking or corresponding with each other always. In search of a solution, in search of some kind of relief, what can we do as an employer to Uber some of this risk to an intermediary or to delegate some of these responsibilities external? Where does it put us? What are the options and what is the guide?
Shaun, in terms of you as an employer having to Uber some of these responsibilities, legally, as an employer, as for instance, as a CEO, I'm just going to do a practical example. As a CEO of the company, you are the 16.1, and here you appoint Shaun. Remember, as the CEO, it's your responsibility to provide a workplace that is safe and without risk. So if you appoint Shaun or you appoint Fumane as a person who is either a consultant or Shaun who is a manager who is going to ensure the implementation of this health and safety procedures, unfortunately, that responsibility does not relieve you of all the other responsibilities in the Occupational Health and Safety Act. So meaning that And the entire responsibility and liability lies with you as an employer, because there's the appointments that you have brought in, that is your support system in ensuring that this is implemented. Hence the commitment in terms of compliance and business continuity always lies with the employer, who is the CEO in this current stage, or the 16.1 as some people would refer it in terms of legislation. So the relieving of those responsibilities is not something that can be done. Instead, the appointments are just the support in ensuring the implementation and adherence in this in the legislation and the requirements.
Thank you, Fumane. I think that's one of the questions that will definitely allow for more questions. And I do think it's very important to say that even though there's a principle or an outline, it's going to remain organizational specific and industry specific and office specific, depending on what your exposure is and what your risk elements are and what hazards you have identified as those that are significant. Talking about that, Fumane, there's a clear indication in our Occupational Health and Safety Act that speaks about reasonable practicability.
Yes.
So reasonable practicability can be interpreted in a lot of different ways. How do you envisage and how do you see reasonable practicability in this case? When can an employer say, but it's not reasonably practicable? Where do you draw the line in your opinion?
And you see, with reasonably practicable, this is why this word, we find it in a lot of occupational health and safety regulations, including the directives, as we have seen, which are specific to COVID-19. You can categorize this in different ways, but the main ones, which would definitely check as to whether that the decision that was made was reasonably practicable, is if the employer has considered the severity of the hazard or the risk that is in the workplace, including the scope. In other words, how big that hazard is or the risk. And then secondly, what they would also have to consider, it's in terms of the availability of knowledge and information that they have. And this comes with as well as the employees and the appointments that you have brought in, to say if a safety officer, for instance, is appointed, or a consultant is appointed, the knowledge and the information that is available to mitigate and reduce that risk, and as well as ensuring that what is the cost as well as the benefit of making sure that you mitigate that risk in that workplace, and ensuring the last part, it's actually it's 4 elements of it. And the last one being the capability, because you can have the knowledge and the information, but were you able to actually reduce this risk or the hazard that was identified at a level whereby it's reasonably practicable? And when you do your risk assessment as an employer, or maybe if, for instance, you do have a consultant or maybe a competent person, just like a compliance officer assisting you in this is where you elaborate and basically break down all the hazards as well as the risk, and bring in the preventative controls or the effective controls to try and mitigate the risk at its most reasonable level. And that's where you will consider all the factors, the severity and the scope, the knowledge and the knowledge of the risk and the means to mitigate it, as well as the capability to reduce it, and cost versus the benefit as well.
Thank you, Fumane. That's a lot of information. I think also a question that I would have had and still trying to resolve is that, so if we're running through that means that I can outsource the risk assessment. I can ask a competent person to come and do a risk assessment or hazard identification and risk assessment and make recommendations. But even if I've done that with an external party that's got the competence or the capability, the decision and implementation and the maintenance of that system and or the responsibility legally still remains with the 16.1. So the person coming in to do that assessment and recommendation does not accept that responsibility. Am I right?
Yes, you're definitely right. And it's quite important that when employers bring in a consultant in their workplace, the consultant must ensure and assist this company by trying by all means to reduce the risk. And we've seen it quite a lot of times now during COVID-19, where employers find themselves in a position whereby they're confused as to whether what is effective or not. Because ultimately, the customers that will be entering that workplace, the activities and the risks that are exposed in that workplace, either to the neighbors or the neighboring companies, the employer in the workplace will be ensuring the implementation of the control measures that were brought in by an outsourced company. An outsourced company or a consultant can come in, yes, definitely. But in terms of the relieving the responsibility of what was not implementable in terms of the OHS Act, their responsibility still lies with the employer. So it's quite important that they also understand and engage in terms of knowing what their risks are within their workplace as well as the hazards.
Awesome. Thank you very much. I just want to reflect on our organization and our journey. So starting off and working through regulations, guides, and directives initially. I mean, somebody posted that there's more than 240 of these different and amended. I think that score has increased quite significantly as we've progressed, and also as we start to perceive and understand it a little bit better. For us, a big breakthrough was at Harambee was to understand what is it that we are trying to do. And again, reasonably practicable, we went to the drawing board to say that what is it that we've got direct influence and control over? And we realized that we have got direct influence and control over the prevention of the spread of COVID-19 occupationally. And the reality that we have is when we sit with our social and ethics committee is that even a full day's work covers an employee for about 25% of their week. And the reality is that 75% of any person's week, if they work on site full time, full FTE, 75% of that still sits outside the office, that we've got direct control over. And the risk is that there's a lot of external elements coming in. If we've got 100% control, then it only has got a 25% impact on an individual. And I mention that because that gave us a true north in what it is that we're trying to do occupationally. Our responsibility was occupational, prevent the spread occupationally, put controls in place occupationally. But I think from a psychological and a social point of view, providing as much information, context, and understanding to make sure that these actions and the risks are mitigated and also lowered when our staff, when our employees go out, and that's 75% of the week, when they are in transport, when they go to church, when they go to the shops, when they visit their loved ones. Sorry, I just wanted to drop that in and what we have learned and how that has helped us just to align to that what is it that we are trying to achieve and understanding our place in this within a sector, within an authority body, within the country, and also internationally, where the reporting comes in so we can understand it and our duty and our responsibility. We have, based on that, made sure that every single person that comes onto our site is treated as a high-risk individual and or a vulnerable employee out of respect for that person and for everybody to be their brother and sister's keeper. We have got a mask-wearing protocol at all times, and the only time that you take your mask off is when you are consuming liquids or foods safely. We make sure that we maintain safe physical distancing at all times. We avoid physical contact at all times. We make sure that there is sanitization available wherever you look. Just the principle that we followed, again, just sharing some best practice. If you look from a fire emergency point of view, being able to evacuate the building, the best practice is that if you stand in a room and you look around you, you must be able to see 2 green running men signs at least. The green running man will indicate a condition of safety. We followed the same protocol, the same application to say that wherever I stand, I must be able to see at least 2 sanitizers. So even though we make people aware, and we keep on making them aware, and I'm just going to share a photo quickly on what ideas we have had from an awareness point of view from Signage, is that we've put in stickers on every single door handle, every water machine, every printer, to make sure that individuals are made aware and they are kept aware of sanitize after touching. And in the same principle, as you look around you and you see 2 green running men signs, you must be able to see 2 hand sanitizers as well, apart from us issuing personal sanitizers to all employees.
Yeah.
Just with the sanitizers and the alcohol, please remember there's still a cost that we also have to adhere to. Fumane, I know that's probably a different webinar, but controls of substances hazardous to health is also a reality. We've seen buildings go up in smoke. It's really big, and if we think that we're not at risk, remember every single person that smokes, every single canister, all of this are combustible, the chemicals that we keep on site. So please ask your team and or speak to your health and safety committee on how safe you are from a chemical management point of view. How much stock can you keep on site, and how do you manage this? But also, I don't want to lose our record or go off our topic too much. Fumane, back to our questions. I'm sorry, do you want to add anything on COSH, Fumane?
And no, but however, as you actually mentioned in terms of the other relevant regulations, and what I wanted to add was saying that you're actually raising a valid point, because Shaun, we must remember at some point, definitely when this pandemic might be over, there are certain applicable regulations as well as the requirements that are still going to be there. So having to ensure that even on the other side, you still keep ensuring that your employees are informed of the other risks is definitely one of the important things. And I think definitely with individuals in the workplace, having to understand that will assist a long way.
Awesome stuff. Thank you so much, Fumane. With that said, and I think it's also talking about different kinds of hazards and different kinds of risks. When we start unpacking it, it's a rabbit hole, because ultimately we've got hazards that we need to take into consideration that are biological, it is chemical, it's physical, it's psychological. And but just to share a story, we've got a lot of individuals that we are caring for, that we know of, that have been affected psychologically from isolation point of view. And again, going back to organizations, if that is the case, make sure you've got your support structures in place and that is communicated. If somebody is feeling isolated, or there is a psychological trauma, that they are also supported, not just getting stuck on what the COVID-19 is, because ultimately a fire can still break out, a first aid incident can still take place, flooding can still take place, a robbery can still take place. So I think an opportunity perhaps for COVID-19 to create a much higher risk perception in our workplaces. And as you said now, which helps us after a COVID-19 pandemic, also to maintain these safe systems of work much better with a bigger awareness. In your exposure, and I mean, you've worked with Return to Work SA, you've assisted us. What would you identify are the biggest areas of non-compliance for organizations during COVID-19, and where we are now, possibly maybe one of the biggest anxieties? Where do you see this, having internal exposure and an external professional view?
You know, Shaun, from the initial stage when we started advising and ensuring that workplaces must definitely understand the importance of implementing the health controls, including the health and safety requirements. One of the things that we realized was the complacency in terms of compliance in workplaces. Either, for instance, and when I mean complacency, I'll try to break it down, because you find that employers found it as quite it was quite a difficult challenge for them in having to identify what's the first thing to do, you know, so they were quite okay with the measures that were kind of still in place, or employees were not adhering to the measures that were implemented in the workplace. And I think it's mainly because, secondly, there was no proper communication. And if you can check in terms of this hazardous identification and controls practice, you will see we identified here in terms of the activity, the hazards, as well as the risk, and how to monitor and evaluate and review the risks, as well as the hierarchy of controls. But one of the biggest elements that we picked up is that if, for instance, I'm just going to do a quick example, is to say, if the activity is of an employee using office equipment that is shared in a workplace, the hazard for that would be them having to frequently touch the common surfaces, of which the risk is the likelihood of spread, and is the likelihood of spread in terms of COVID-19. And then we looked at the measures in terms of how now are you going to bring in and control implement the controls. And if an employer is unable to eliminate or substitute or as well put in the engineering controls of this, they would resort definitely to an administrative control, which is having to say this employees can either rotate in having to use these shared surfaces, so that they should be the cleaning or disinfection which is put in process. But as well, they were providing them with personal protective equipment in addition to the controls that they had put in. But as we monitor, we could see that there were still some gaps, in a sense that they were still getting some of the positive transmissions in their workplaces. And when we looked at the review plan, what we had to do was to evaluate to say, if, for instance, an employer has implemented all these control measures, but you find that consistently there's still non-compliance in the workplace, what else could it be? And that's where we could also see and consider that behavior definitely is one of the risks, as well as the controls that we can try and advise an employer to implement in a workplace. And if we say behavior, when it's considered in terms of the element of control, it means that this is the relationship of how information is communicated between employer and employee, and how that employee understands that. But also an employee must understand that if they don't adhere to those measures, there will be precautions that could be taken for them not adhering to those measures or controls that were implemented. You see, so I think definitely complacency, which is the behavior, because as we can see, even in the current state that we are in the country, there have been numerous increase of cases, to such an extent now we're almost hitting literally the second wave. And you wonder as to what type of precautions, what type of controls are we going to bring in which are extra. But definitely a behavior element is one of the things that we have realized, that once there's alignment in behavior in the workplace, it kind of brings in, reduces the transmission in the workplace to a great extent.
Awesome. Thank you, Fumane. I mean, when we talk about that, it just makes me think about a culture again, and just repetition. And I mean, we know that it takes a little while to, well, what are they say, about 28 days to create a habit. And then a lot quicker to lose that habit. So I think if there's not a constant focus and supervision from leadership and from an organization, then we cannot expect this thing to just run itself. So finding intuitive ways for an organization to keep staff and stakeholders aware and in line, I think, is critical. I want to share a control that we've put in place after we had to reassess and when we deemed that some of our systems have failed. And the system that we have implemented was a technology solution. And the team has put together a platform in the form of a WhatsApp chatbot. And this WhatsApp chatbot creates an opportunity for at low data. And we know that majority of our staff members, friends, families, colleagues, all of them have got smartphones. So the option one would be a personal declaration, to make sure that they have informed the employer of what the health condition is, and if there are any kinds of comorbidities. Based on that, we have established a very simplistic risk matrix to identify who is at what risk category based on our internal process, keeping confidentiality top of mind, and just a very simple action and clearance guide, so that if an individual is a moderate risk or a high risk or a severe or a very high risk, what is the actions that will be taken by people or a HR team in order to support that person, and also how do we accommodate them on site. I've already alluded that we went into accommodating everybody as a high risk or a vulnerable employee out of respect and being each other's keeper, to make sure that the mask, the distancing, the sanitization, the ventilation, etc., all of that remains intact. Back to the tech solution. So number one is to update your declaration. So whenever somebody's situation has changed, they've traveled, they're ill, booked off, whatever the case may be, or become a PUI, they'll update their declaration, which gives us as an organization a risk profile of our entire staff complement. Second to that is an on-site request. The on-site request is for first time coming on site or after you've been booked off. And this is also a process that we will be following when we come back on the 4th of January next year, where everybody would have to request to come on site again. That process have got 3 tiers inside. Number one, it stops with our people team that does a clearance, pre-clearance based on the declaration. Number 2, it goes through to the operations team or the executive to make sure that this is a critical function under the circumstances and that this person will be working on site in the case that they need to be supported, worst case scenario, COIDA or a shifting or a rotation basis. And then third and final of the option 2 would be a facilities and health and safety accommodation. And for that, making sure that person comes into an on-site induction, that is documented and information has been transferred effectively, that they are issued with the appropriate PPE, that the induction, which is a theory and a walkthrough part, make sure that they are walked through and spoken and talked through all the protocols, just to eliminate that gap that there was in the past of non-adherence or individuals saying that they were not aware or it wasn't explained to them. So we've covered that gap just by simply saying that we need to sharpen the axe in order to cut the tree down quicker. Option 3 is a daily pre-screening that takes place. So each one of our staff members goes into the WhatsApp bot, they say hi. Option number 3 takes them into a pre-screening. The pre-screening will ask 4 main category questions. Number 1, are you healthy? And if you say yes, then it proceeds. Do you have permission to be on site? Yes. Do you, will you update your declaration if your situation changes in order to help us to make informed decisions as an organization? They say yes. The last one is to say that a commitment that I will follow the safety protocols on site. And these are then outlined. I will wear my mask. I will keep my distance. I will avoid contact. I will wash and sanitize. And I will stick to zones where there's certain areas that are out of bounds. Through this, we have created a very low touch and a very low risk solution for us to be able to not just collate information, but also keep data as is requested by some of the directives and regulations that have come through. This information, I mean, we don't endorse any of this directly. We do use it, and it's been successful for our purpose. In some cases, it might not be exactly the same, and you are comfortable with a manual process. But this gave us the opportunity to manage multi-sites, which includes a Rwanda and a Cape Town and a PE and a KZN and a East London and a Gauteng. So just sharing some best practices. Another best practice that I just want to share briefly is that we have basically counter-engineered some of our protocols, and we've got a framework that we've created to say that when will we close our office? And based on that, we've worked it back to say that what do we then need to do not to close our office? And office closure being a practical and a tangible evidence that something has gone wrong. A system has failed, or the external elements are just so big that we cannot control it. And outlined there, I'm not going to go through it verbatim, but outlined there is just to say that if we need time to investigate, it is unsafe, then we need to make a plan or we need to close the office. Same with time to disinfect. I mean, there we've got the regulations in between shifts, after shifts, and cleaning throughout the day. If there's evidence of on-site transmission, then being able to investigate. And if that becomes so big that we cannot guarantee or protect employees all at the same time, then we also need to buy ourselves time and inform employees to either quarantine or isolate while we do the investigation and while we report. External risks, and these are risks to external parties. And you can think about malls and shopping centers that have closed due to coronavirus outbreaks or reported outbreaks. So in that case, we've limited our external exposure. We had public coming into the office. We've reinvented a lot of our systems to make it more online and make it more digitized, if I can call it. External closure and external closure, number 1 could be an inspector coming through closing us for non-compliance. It could be that there's a whistleblower that just doesn't want to come to work and needs to be investigated. It could be that the regulation changes from a lockdown point of view, or that certain industries are not deemed critical anymore. We have seen that, and we've gone through the different risk-adjusted levels. It could also be that if you are in a building where the landlord has got a protocol or a system to protect, that you might be affected through that. So also important just to understand what your landlord and your hosts regulations or protocols say. Apart from that, and that's just baseline, apart from that, issue-based does not stop anywhere. And that's also part of our duty to care. But understand that, if certain key elements are compromised, you need to have a backup plan. You need to have business continuity and plan ahead for that. And there's just some elements that we've outlined. They're very, very, very simplistic to say that, if we don't have PPE, can we still keep the office? Do we need to keep backup PPE? Supervision, as we spoke now, no matter how good the system is, if there's nobody supervising the process or doing the screening on site, etc., then it would lead to increased risk, to a point where an organization or an executive might need to make a decision to say, okay, cool, close for what period, and what is the purpose? Ultimately, to protect, understanding that closure and the risk is not just health and safety risks, but it's also quality risks and livelihood risks and reputational. When you go through to the next question that we've got here, there's a multitude of platforms where we can gather information, and I know that we've all found our mojo or our likings in different kinds of platforms. What platforms come to mind for single truth information and updated regulations?
Shaun, one of the things which I can basically recommend for access to platform, firstly, a person needs to check the website, which definitely has reliable information and consistent updates, as well as the legal requirements, because that will be able to, in terms of how consistent is this information, how is it reliable, and is it applicable to me in terms of the legal requirements which are being required in the country or either in the work premises. And what I've realized, some of the very useful platforms are the National Institute for Occupational Health website, as well as the Return to Work website. And this was a platform that was created during the early levels of the lockdown that provided businesses with the legal requirements in terms of them remaining safe and ensuring that they remain safe during all the levels of the lockdown as they were being implemented and being eased. And the reason for that is because the Return to Work provided a very practical and implementable solutions which employers could use, even the templates in terms of how should they use this template and in what area and in terms of what operations. So that would definitely provide a great baseline for an employer who wants to get access for information, including the employees as well. And yes, even some of the information which would be relevant for next year in terms of the training that employers can use for changing behavior in the workplace, so they can easily get that information.
I know that there's wonderful information and source of information on the PEPESA website too, that is informed
Correct.
by some of these the national regulations too. So also I think it's also simplified there and also just made relevant. But it's a direct correlation and a reference to some of the national documents that have been made available. We touched on NIO briefly. There is new reporting requirements that have come out. We've touched that and unpacked it and had some interesting conversations. For Mali, I think just importantly, what are the main categories of reporting? And then if there was a golden nugget from each of those, what would it be in your opinion?
I think for each and every employer, I think the most important thing that they must remember is that when they have the reason for reporting will provide them with a certain benefit. And in terms of the slide, as you can see, prior to even understanding as to what should I report, but maybe it would be great if we just break into why is it important to report? Because if you report, you're able to evaluate and analyze what type of results in a workplace you're likely to have. And what we look into in terms of reporting is to say, the information that you have gives you an element of what you can monitor, what you can control, and what you can reduce. And the NIOH at this current stage basically requests an employer for all the positive cases to be reported to them. And that is on a weekly basis. And it is quite important that employers must also remember to report to their sectors as well, as this would give alignment in terms of what is happening at a sector level. We understand that at this current stage, there is quite low reporting from businesses into sectors, but definitely it's quite important that we must not leave that part out. But all the positive cases should be reported to their sectors, including NIOH. And the other part which is quite important for them to report is in terms of the vulnerability screening reports of the employees. In other words, all your vulnerable employee data should be reported to the NIOH, as well as the positive cases and those that have asymptomatic the asymptomatic the asymptomatic symptoms. Yes. And lastly as well, in terms of the return back to work plan, in terms of how they've been monitoring an employee. So it's quite important that business should remember to report that, as well as including to their sectors, particularly for the positive cases.
Thank you, Fumane. I remember an interesting conversation that we had where there was a guide in terms of this reporting specifically, outdated from August, that referred to the reportable for employers with more than 500 employees. That changed towards the end of October, and there's a new guide out in November that talks to anybody with more than 50.
More than 50,
employees.
Correct.
But there's also other changes that took place there. And I think if we can just unpack occupational quickly, in just your understanding on, when do we report this and when don't we? And what about employees that are working remotely, working from home? Just from a reporting point of view, in your opinion, and also in terms of COIDA, etc., where does the buck stop?
You see, there's it's quite a thin line, because for occupationally acquired, you have to report all those cases to an NLH, as well as compensation to the compensation commissioner. And the compensation commissioner has a legal way of them having to identify in terms of what was occupationally acquired. And this is why in the form which they request you to complete, you will see they're trying to check in terms of the exposure, as well as your occupational exposure of the person who's under investigation or a confirmed COVID-19 case. And they will try to check as to whether that person has been traveling either to areas or work premises that have a high exposure. So there's an element in which even you at an employer level, when you've identified a positive case, the compensation commissioner is going to apply and interact that. But now let's go back to your question as to if, for instance, an employee is working remotely and they are now identified to have a positive case. The question, it's quite important for that employee to disclose as to whether during, for instance, there are employees that work remotely, that work directly from their home to the clients of the company or the business. Now that's a different exposure. But for a person who is always home, who is working from home and was exposed socially due to either them going out for social events, unfortunately, that cannot be considered as an occupational exposure. But for that one who's working from home, as I'm driving from my house and I'm driving to the employer's client, during that period where I've been engaging with different clients in different areas, the exposure could have likely happened during that time. And it's quite important that they must report that to an employer, so that compensation commissioner should make that definition as to whether it can be able to compensate or not. And with NIOH as well, they basically say for a positive case that was occupationally acquired, it should be reported to them.
Fumane, thank you. Occupationally acquired, there's a guide from the Department of Employment and Labour that outlines what they deem high risk occupations. And obviously internally, based on every organization's own risk assessment, they can identify in their terms, or in their policy, what are high risk exposures within their will. And what I've learned from there is that the high risk occupations outlined was more doctors and nurses and people working in laboratories that actually do their COVID-19 tests, more workers, those going in community for testing, etc. On our side, what we've identified as our high risk occupations are those that are the first responders, the first aiders, and also doing the assessments on PUIs, persons under investigation, cleaners, our screening officers, and at times even some of the compliance officers, because they do get to deal with a lot of different elements. So I think it's important just for every organization to understand that there is a baseline developed by the Department of Employment and Labour, but it's still our duty to do our own internal assessment to see that which of our employees or job descriptions are high risk based on us? And if we put controls in place, what are those controls? You know, is it just a mask, or is the mask and a face shield? Is it gloves because they work with chemicals, etc.? So just again, just back to that slide number 20, which just gives an idea from our side what we've done. We've identified different job descriptions and then what kind of activities they do. And based on our assessment, is it a low risk, a moderate risk, or a high risk? Take into consideration that we've already put in place a lot of different measures, not talking to the Department of Employment and Labour baseline, but to our own issue-based assessment. Fumane, I know that there's clear directives and guidelines in a lot of the regulation on what we need to do and to maintain safety, and it includes masks and safe distancing, screening, washing and sanitization, ventilation, space planning, all of that. And I think we're all well versed in that. Say that we've got all of this in place as an employer, and we've got employees that do not want to come to work. So they refuse to come to work either, and I'm going to ask you a double barrel question, either because of external factors, number one, and currently thinking about public transport, and number two, internal aspects where they feel unsafe about. How do we handle these? So it's an employee refusing to come to work due to an external element versus an internal element. Just guide us on that, please.
I think, Shaun, the employee having to refuse to come to work due to an external factor or exposure of COVID-19, already that is an unlawful practice, in a sense that exposure that is occupational, the employer can only control and implement and monitor and assess what is internal. In other words, what is occupational in the workplace or where a workplace is at, you understand? So if an employee refuses to come to work due to external factors, that employer has a right to basically either report that employee or take, for instance, in terms of basic conditions of employment act, take on the legal actions with that employee having to refuse to come to work, because it is an unlawful request which they are making, because the employer does not have control over any external exposure. As you're speaking of, an example would be public transport. But if it's internal, an employee needs to understand it is their responsibility. You cannot refuse to come to work. Instead, what you should do, and this is how we basically refer it to behavior element in a workplace, an employee should raise non-compliance or risk that they are being exposed to an employer, and these things can be solved internally, and understand that the employer needs to act onto that non-compliance that was identified. If it's an unsafe procedure internally, they must raise it. Employer must address it. While it's being addressed, then employees cannot be exposed in that environment. So it's important that employees should understand how to handle their non-compliance within their workplace, as well as non-compliance externally. And externally is not within the employer's responsibility.
Awesome. Thank you, Fumane. I do believe that meaning in our nature and our duty to care, all of that consideration can still be taken into account. And the suggestion would be to put out a safe use of public transport guide to make sure that your staff know how to act safely and how to make themselves safer when exposed to these elements. So it's definitely, even though it's not occupational as such directly, if we do not create those transport solutions, we still have a duty to make sure that we inform and help wherever we can without accepting the accountability responsibility as such, but
Absolutely.
just from a duty to care. Fumane, we've touched briefly now on social and occupational. So now there's year-end functions going on. There's a lot of stuff going on. But just in your opinion, how would you approach a work year-end function during the pandemic?
Shaun, for the year-end function during the pandemic, what I know there are limitations and requirements in terms of gatherings, and I'm sure all the employers and workplaces would like to gather around now, because everybody has been socially not been interacting within a workplace, within their work environment, and I'm sure they're looking forward to that. Ideally, if an employer decides to have a year-end function, they must also consider the exposure which is going to happen, particularly where there could be transmission, and even if it's that transmission could have not occurred during that year-end function, but the fact that there was a year-end function could kind of create a very difficult position for them, having to deal with the cases that are likely to be reported. So if an employer decides to do a year-end function, they should definitely ensure that they implement the controls, and they ensure that they go to workplaces that are complying with the requirements in terms of occupancy, in ensuring that the health and safety practices are implemented. But for those that are not that will not consider to have their end function, it is greatly understood, and it's important that they must also inform their employees in terms of the decision as to why this was taken, which is mostly in bringing in the health and safety of their employees as a priority, and trying to reduce the risk of exposure to them during this time of holiday and festive, as they will also be going to interact with their families. So it's quite a difficult one, but I think the precautions can be considered in both, and communication should be open with all the employees.
So a year-end function is occupational exposure. We need to apply the same kind of risk-based thinking and the same kind of approach, because ultimately with contact tracing, that's going to have to be noted as a spreader event in a worst-case scenario. So thank you very much, Fumane. I think that also brings us to a final question. I'm aware of the time, just so we can open up for questions from the audience too. And you've already alluded to it. So now we're going into a festive period. People will be traveling. We've seen what happens around us. And the reality is that, you know, because there's controls at work, it's deemed to think that only work is unsafe. So now we've got a lot of our staff members going away. They're coming back. Most of staff members probably coming back on the 4th of January. I'm going to just share a preliminary best practice approach that we've got at the moment that we are considering for return to work. And I'll ask Fumane just to weigh in there with some other considerations, not taking away from the principles that we've already discussed from a risk assessment point of view, making sure all the controls are in place and that we adhere to all the external elements, not knowing what tomorrow will hold for us after the president's speech tonight, but also what elements we will be faced with and then the impact thereof. We are discussing on our side to have a staggered approach or a phased-in approach come January 2021. And we're just following a simple pragmatic plan of assess, plan, implement, and action. And we're doing that in all our offices to make sure that before we come back to the office, we are able to assess the situation. Again, take into consideration external, internal elements and aspects and impacts, making all the considerations, then putting a plan together on how we will be bringing our staff back, either per department or per job category or per site or situation, involving the relevant departments there. And as you know, we work closely with our safety, facilities, HR, finance, executive team, and ops team, but to put that plan together and then implement it. And implementing and planning could include that we do a full declaration, recon on all our staff returning to the office, making sure that our sites are set up during the Monday, Tuesday, which is the 4th and the 5th of January, and then having our staff come back on site on the 6th of January, that Wednesday, for refresher induction training, as that forms a key and critical part of our duty to inform, but also to make sure that there's full adherence, make sure everybody's still got their PPE, and that we can communicate any changes that might have taken place. So just an idea on the screen there. Before I hand over I will hand over to Fumane just for a comment on this, and I just want to share some cool links that we've also benefited from before I hand over back to Tracy. Over to you, Fumane.
Shaun, to all the employers and to definitely the recommendations that you have made in terms of the returning back to work safely next year into 2021, I agree with the terms that you have definitely put. And in addition to that, it is quite important that as employers come back with their employees in reopening, they should definitely ensure that they try and reconduct an induction as well as a refresher course, in addition to the comments that you have made in terms of the health and safety protocols that were implemented, but as well advising their employees to basically disclose in terms of the provinces that they may have traveled to. And I love the fact that you're definitely considering each and every employee as a high risk, because it's during that time when we have to come back, we have to ensure that we are each other's keeper and ensure that there's business continuity, there's safety, and as well as there's productivity and less transmission in workplaces. So thank you very much.
Awesome. Thanks so much, Fumane. I just want to share some really good links and tools that I've benefited from. One, traveling and also promoting it through our staff. It's a COVID alert SA app. It's also promoted by our president, just to make sure that our phones can join the fight against, and obviously help with contact tracing. There are multiple self-checkers on symptom checkers that you can use. I know it's outlined well in all the PUI documents and emergency response documents. If you're looking for an online solution where you can do a self-checker for yourself or for somebody in your employee or a loved one, if you're concerned about them, there is the CDC link that you can use, amongst others. A course that I found really interesting was a complimentary course provided by Johns Hopkins University with regards to contact tracing, which gave a lot of insight into understanding what are the infectious periods, what are the significant symptom periods, etc. And it just helped us guiding our contact tracing and case confirmation so much better, just having the right information and being more competent. As we said, competence comes from skill, knowledge, ability, training, and experience. Just helped us to make a lot more informed decisions. We've not managed to go through all the questions, but I just want to thank Fumane. Thank you very much for your insights. Thank you for allowing me to put you on the spot and just answering honestly from your experience, point of view, and also how we have learned. We welcome feedback on this, and we look forward to sharing this pack, and also if there's more frequently asked questions that we can all lean into. I think we can definitely learn from each other. So thank you very much, Fumane. Thank you, Tracy, back to you.
Thank you very much, Shaun.
Awesome. Shaun, Fumane, thank you so much. You've given such a wealth of information, and what I really appreciate is that you've kind of deep dived into some of the basic areas that I think a lot of us, like you say, the big word is complacency. A lot of us have sort of forgotten about, or we assume everybody knows, and that's not always the case. And I think that this is probably a good segue into Chris Lawson actually taking us through his presentation. Chris, if you're happy, you can hop onto video, and I've put your screen up, so when you're ready, we can get started there. But this is really just an opportunity for all of us to actually hear from one of our operators on the ground, some practical tips and tricks. They employ the same grouping of youth individuals that you do, so understand that there's certain nuances when it comes to working with our youth, as opposed to an older community who may be a little bit more risk averse, which is definitely what we're seeing. And unfortunately, something like our super spreader event that we saw happening in KZN recently with our matriculants just reinforces the fact that youth don't see risk the same way that we may see it as employers. So Chris, are you on? Can you hop off of mute and onto video? I'm actually just checking. I hope we haven't lost you. Sorry, I'm on two screens here.
Hi, Tracy. Can you hear me?
You are there. Oh, there you are.
Great.
Hello.
Sorry,
Okay,
my video is not working on my laptop, unfortunately, so it's just going to have to be a voiceover. So thanks for the introduction, and thanks, Shaun and Fumane. You know, that's great information that you guys have shared there. Really, what I wanted to do today is take you through a couple of high-level bullet points. You know, speak a little bit to some of the key takeaways that we've learned over the sort of 9 months of this journey, and then share with you guys a couple of examples of some of the awareness posters that we are using actively across our organization. Tracy, are you going to drive or do I have the ability? Okay, I see you. You're going to be driving there. Thanks. So the very first bullet, as I say here, is you can never do enough training and awareness. This is, if not the most important thing that anyone can do in the industry at this moment in time. And what we found as well is we shouldn't just asphyxiate on one type of awareness. So originally in the beginning, we relied purely on posters. But what we found after time, people don't actually see the posters or actually read the content anymore. They just pass by it. So we had a sort of blended campaign on communication. So it was email communications, it was physical posters, it was a customized screensaver that was pushed out to every single desktop. We had LMS modules, that's learning management system modules, as well as did a lot of face-to-face, as in virtual face-to-face, using Teams and Skype and that kind of thing. So we used a blended methodology. In addition to that, what we also found specifically when it came to the posters is, as I mentioned earlier, people tend to not observe posters anymore because they're used to them being there, so they don't see them. So what we've actually done is every sort of 2 months, we totally refresh all the posters around the organization. We change the colors, we change the content, the look, the feel, everything. So staff are engaged again. So that's some of the things that we've done from a communication perspective. The other important bullet point there was what we found as we called it sort of a COVID crisis team. It was a bunch of the leadership and senior management that got together that sort of ran this project of COVID compliance from start right up to this day. We still meet 3 times a week and share notes and look at opportunities to enhance and better things. But one of the key things that we identified earlier on in the process was to conduct an employee survey and understand from our staff what is working and what is not working, or what would they like to see more of or not see more of, or if they have any concerns or issues, what would they like to see us doing to address those? Because a lot of the times, us that are engrossed in these projects that have sort of information fatigue and that kind of thing, we tend to assume we know what's best for the people, and rightfully so, we're not always. And our staff are a great sounding board, and we listened to a lot of their suggestions and addressed it accordingly and rolled that out across the organization. One of those, for example, was the posters, and refresh them and use sort of different colors, brighter colors and content constantly. So that's really worked for us. Another key aspect of our journey is, and we say military style, but it's that military style entry and exit protocol. To us, this is an absolute non-negotiable. We have to ensure that we bring our staff into our buildings in a secure and safe manner on a daily basis, as well as we exit them from our buildings in the same way. We need to enforce at all times the social distancing. We do, make sure that the temperatures are taken, PPE is issued where required, declarations are completed, work permits are checked, especially travel permits, now that we do still or are still experiencing a curfew from midnight to 4 a.m. and sanitization is taking place. To us, that's our sort of key barrier as the entry into the organization. A lot of the protocol in our entry and our exit are self-help or non-touch. So temperature screening, as well as identification, verification is all non-touch. Very similar to your shopping centers and your supermarket outlets when they scan the barcodes of a lot of the food items. We do a fairly similar thing with our ingress protocol, whereby a staff member member gets screened, non-touch. Straight after that, they produce their government-issued identification documentation, so either a driver's license, ID card, or the sort of green identification booklet. That gets scanned. Based on it being scanned, it automatically pulls forward the data from our internal HR system, and then we take everybody through a daily declaration where they answer, key questions like, have you been in contact? Do you have any symptoms? Are you awaiting sort of any test results, etc.? And that happens on a daily basis, which is it's an absolute non-negotiable for every single staff member. As I mentioned earlier, our entry point is most critically our barrier to ensuring that our staff are safe on site and preventing, any on-site infection and spread. This has worked extremely well for us to date. So it still holds flag quite high in the crisis team. Avoid paper usage wherever possible and leverage digital options. Way in the beginning when we opened our doors, we relied very heavily on paper-based items. We have gone through a digitization journey, and very little is paper-based at this moment in time. Everything is online, it's all digitized, no touch. That also helps hugely on a weekly basis, with our reporting obligations, both via our industry sector, BPESA, or to NIH, etc. So that digitization is really a key win for us as an organization. Cleaning and sanitization. This is a non-stop ongoing exercise 24/7, 365. We are a 24/7, 365 operation. So there is cleaning that takes, before shift, post shift, 4-hourly intervals, every day, 365. We also have a fairly large health and safety or SHE-REP population. So we have 100 SHE-REPs across our different facilities, and we rely heavily on the SHE-REPs. They are active, constantly walking the floors, engaging staff, they're driving awareness, they're checking for compliance at all times. If they identify any persons not complying with any of our on-site protocols, we have an online form which they can formally lodge a breach. When they lodge a breach, we as an organization enhanced our existing internal disciplinary code, and we've annexed a COVID disciplinary code that supports that. So any sort of breach of not wearing, PPE or not social distancing and those kinds of things are formally recorded, and our HC team formally engage those individuals that have breached the protocol, and they go through the disciplinary process. We also actively track and monitor those repeat offenders, and those two are dealt with via the disciplinary code for COVID controls. Do not underestimate the fear and anxiety factor. I can't remember if it was Fumane or Shaun that mentioned this earlier, but it's real. People are scared, and what we do find is they're very complacent if they haven't had a loved one or been in contact with somebody, or they themselves haven't been positive. But as soon as a loved one or a close friend is a positive and they now become a PUI for whatever reason, that anxiety level spikes, that fear spikes. And, we just make sure that we have a lot of support for the staff in that regard, both from our human capital team, as well as from the health and safety representatives. We have a dedicated team of staff that any of our staff members that are at home, either as a PUI or a PCE, they are contacted daily, to offer support throughout the entire journey. Keep things simple. Don't overcomplicate a process. This is a lesson we learned early on, where we tend to, overboil everything and want everything to be absolutely perfect. But sometimes, the little things are what count. The next item there is collaborative process design and dedication, dictating process. So these are the two swaying factors of the scale. One, we, in the beginning, because we needed to make sure that we enforce process and protocols very quickly, we tended to dictate what needed to happen. At the back of the employee survey, we realized, whoa, guys, we need to take a step back here and we need to work together with the organization, with the operations, with the actual staff. And we enhanced all our protocols over that sort of period of time. That's high level, the lessons learned, from key takeouts, if you were to call it, the last couple of months as a journey. Tracy, if you wouldn't mind just popping on to the next slide. Here's a little bit of an example of our current version of slides and screensaver information that we have. This is just a very small snippet of about, I think we've got about 32 or 33 odd sort of dedicated images with very specific content at this moment in time, and these posters are everywhere in our organization, from entering into our buildings to our general areas, to the bathrooms, to the lifts, to the operational floors. It's everywhere, as well as permanently on as screensavers across all our machines in the entire organization, flipping through that content. And that's really it from my side. I'm not sure if there's any questions that anybody would like to ask.
Awesome. Thank you so much, Chris. Really, really appreciate you sharing some of the details and the realities that you've been living and what you've put in place. I'd really like to open up the mics now and open up the floor to anyone, to give some additional insights, what you've done, challenges that you've had, ideas, suggestions. The reason that we've managed to work, sort of mitigate the spread as much as what we have in our sector is because of you, as I said, because of everybody sharing. And just to let you know that we have been recognized again locally, but as well as internationally as a sector, with the amount of collaboration we've had as an industry. Which is not all that common across many industries, but specifically in the GBS sector. So again, I just want to say thank you to everybody for working together as the GBS family and really trying to help one another. So really the floor is yours. Are there any additional questions, or are we all sitting here going, whoopsie, we've got to go back to the drawing board and just relook some of our protocols, our processes, and kind of a reality check moment? Chris, Shaun, Fumane, I think that you've got everybody thinking. Just to repeat, I will be sharing the presentation as well as this recording so that you can share it with your teams, with your groups. And then just to let you know that Fumane very kindly re-looked our protocols that you all currently have. Those protocols are 7.2 at the moment. There are some updates that we had requested Department of Health to sign off. We're very conscious of the fact that we take a people first approach in our industry. So that is always where we're going to lead from, making sure that our staff and yourselves are safe within the world of work, within the workplace. Having said that, we also are very conscious of the fact that as an industry, you literally had to dig deep into your pockets to make sure that we did comply with everything that needed to be complied with. And we definitely did pick up a couple of unexpected costs this year. So we did look at the protocols from that perspective to say where potentially could we remove some of the cost elements, the cost items. So those are some of the things that we also put into the revised protocols, which you haven't seen as yet. Again, we're just waiting for Department of Health to sign those off. But the delay is actually a blessing in disguise, because Fumane, with her expertise, actually picked up one or two things that we needed to tighten up on in the protocols. Nothing more for you to implement, but just to make sure that we have all the correct language in the protocols, but then also make sure that the employers themselves are not taking all the responsibility. And if I go back to the start of the session today, there's a responsibility on the employees as well for themselves to take a certain amount of responsibility. So that is just really reinforced in the protocols. So Shaun, Fumane, is there anything else that you would like to add in that you've thought of while Chris was presenting, or that we didn't get to? You're on mute, Fumane.
Sorry, Tracy. Yes, definitely. I think what I will definitely take away from this is the fact that as all the sectors are trying to reopen, and as I was listening to Chris, one of the important things which he re-emphasized was that you can never communicate information enough. And as Shaun and I have definitely covered some of the elements of behavior, it's also in one of my minds that coming back, we can never communicate information enough to the employees as well as to businesses and the sector. So hopefully that everybody remains safe. Yes.
Thank you, Fumane. Also, thank you, Tracy. I think just hearing Chris speaking about information fatigue or data fatigue, it's such a reality because we sit in the midst of it and we tend to underestimate or overestimate the understanding of our peers and our subordinates and our employees, those that look to us for answers. So I really like just keep it simple. Just back to the points made now and make it all inclusive. It is something that everybody has to drive. It can't be something that we run off posters on the wall. It has to be ingrained. And yeah, just on this team for you, Tracy, thank you very much for driving us with us. And just for everybody out there, just keep it up. Whenever you feel that you are alone, you're not. There's a lot of us that are battling the same questions and also asking for the same kind of clarity. And I would definitely welcome us revisiting this platform early in the new year to share more. Where are we and what have we learned, just so that we don't find ourselves isolated. Exactly to that psychological point that was just raised. So thank you very much, Tracy. Thank you, everybody.
No, 100%, Shaun. Thank you so much. And thank you so much, Fumane, for your expertise as well. And just to reinforce that point, this has been new for all of us and we've all collectively learned. Bapesa has had the benefits of working with our partners like our social partner, Harambee, like our national partner, the Department of Trade, Industry and Competition, working with BUSA, Business Unity South Africa, and then of course the Public-Private Growth Initiative, which sits at the Presidency's office. And all of this has allowed us to really engage deeply, meaningfully. We've pulled in where we needed to labor lawyers to get expert advice to make sure we're not guessing. There is no stupid question when it comes to COVID, when it comes to lockdown, when it comes to protocols. So please do feel free to continue asking the questions. If you're not on any of our regional WhatsApp groups, please do let me know so we can make sure that you are on there. I know that it, again, to Shaun's point, it may seem like information overload sometimes. There are some fun things that we put on and obviously reminders of certain sort of other events that are happening in the sector. But for the WhatsApp groups were set up specifically from a COVID perspective to ensure that there's real-time communication coming through to you. So if there's anyone else that you feel should be on those groups, please let us know. Bapesa remains open through the rest of December. So there will be somebody available. One of us will be available. So if you do get an out of office, you'll know who else to get hold of. Myself, I will be here. You hopefully have all got my number. Any queries, any questions, please do give me a shout. And then from a weekly reporting perspective, we have asked that if you personally are not going to be around over the December period up into January, please let us have an alternate. It is important that we continue reporting. And I think we will hear from the President this evening that there's going to be a few additional compliance regulations coming in, specifically in what they're considering hotspot areas. This is me with my crystal ball. I may be wrong. But if that is the case, even more so, you're going to see on the ground law enforcement getting a little bit firmer, possibly visiting you. And one of the things that, thankfully, for those of you who have been reporting, when they do arrive and they want to see that you're complying, if you've been reporting to Bapesa, we've got your back. We can show that you have been reporting. We can endorse that, but you'll also have evidence of having reported. So yeah, please do make sure that you are continuing to do that. And thank you so much to each and every one of you. I'm seeing some great messages coming through here now. Again, we're in this together. So please be safe, keep well, look after your environments, your staff, your organizations, yourselves, and of course your families. And we wish you all a wonderful holiday period. And yeah, let's be strong when we come back in 2021. Awesome. Thank you, everybody.